Hey, are you wondering how to adjust your squat so that you can avoid falling backwards? Well, in today's video, I'm going to show you exactly how to do that. Real quick, my name's Dr. David Madoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. This channel is dedicated to helping people stay active, healthy, and mobile while avoiding unnecessary surgeries, injections, and medications. Don't forget to subscribe and turn on your notification bell so that you don't miss out on any of the great tips that we upload every single week. I've got Dr. Sam here to help me out. She's going to demonstrate the squat as I talk through this. And at home, if you're figuring this out yourself, you might want to watch the video first before you do it, or pause it just so you have a chance to do all the things that I'm talking about here so that you're not falling backwards or going a little too fast here. But one of the biggest problems that people run into when they're learning how to squat best is they tend to lose their balance backwards. And as a result, they'll compensate by leaning forwards. So let me show you what I mean. Let's have you stand up here. We'll just move this stool out of the way. I'm going to have Sam stand sideways, so she's going to face that way. Just move a little closer to the wall so you can make sure that your feet are in the frame. Take a half step forward, please. Perfect. So most people will start to squat. Go ahead and start to squat, and their bottom will come backwards quite a bit. And if we tell them, get your feet flatter and your shoulders higher, they'll start to lose their balance. I'll save you back here. That's pretty good. And so what they'll do to compensate is they'll stay forward with their heads and shoulders. So yeah, they'll do more of a back bend hip hinge than an actual squat. You can see the angle in her legs here. She's quite bent here at the hip, which is okay, but hardly anything at the knees. Some people, you can come out of there. Some people will also do this to protect their knees because the deeper that they bend their knees, the more aggravating it can be for an osteoarthritis problem, a meniscus problem, or some other inflammation, swelling issue inside the knee joint. Now, just a quick disclaimer, if you've got any of those types of problems and you already know this is going to hurt you, this is not the time to do this. This is more of a correction to do for somebody who's got mild knee pain, or they're recovering from some severe knee problem and they're looking to optimize their squat so that they can get strength in the right muscles to protect themselves from getting problems later on in life. So let me show you the adjustments that you need to make in order to squat better without losing your balance backwards. So go ahead and face the camera this time, Dr. Sam. Perfect. Key thing to do is make sure you open your feet about hip to shoulder width apart. There isn't a specific distance. It's just a comfortable distance, and you might need to adjust and play with it as you keep going. The next thing you want to do is turn your toes out a good amount, not all the way out as far as you can, but out a comfortable amount. And you'll have to adjust this as you go along. And pardon the sweating here, we're dealing with no air conditioning, and we're in El Paso, Texas, where it's been over 100 degrees for the past week or two. And today's no exception. So we're gonna have pit stains and beads of sweat. I sweat so easy. Anyways, so once you got your feet set, feet apart about hip or shoulder width apart, toes out just a bit, then go ahead and start to squat. But when you squat, you got to drop your bottom straight down. A lot of people call this like a ballerina squat or a plie squat. And notice how her knees are open pretty wide over her toes. Go ahead and come up. Now, I did do a video recently on letting your knees pass your toes. We'll link that in the description below here. But it is okay to let your knees pass your toes. You can catch all the details about why that is in the video that I put in the description. But when you squat like this, depending on the length of your leg bones and everything, your knees will likely pass your toes, and it's perfectly fine as long as it's not aggravating your knees more. And I'll speak to when you should avoid going too deep in a second. Let's have you go down again. And the trick that I want you to do here is make sure that your knees are wide, because often when people are squatting too far forward, go ahead and lean forward. Yeah, their knees will come in, and it forces you to use your quads on the front of your thighs here. Go ahead and come up for a second. But when you squat like this, where you drop your bottom straight down and try to keep your spine, your chest and shoulders and head more vertical, then it forces you to take some of the tension off your quads and use the butt muscles in the back. So yeah, she's doing it already. Perfect. See how she's more upright up here. Pushing those knees out turns on the booty muscles in the back, which is perfect. That's what you should be using to accomplish a squat like this and save your knees and make sure that it's not aggravating anything. You can see she's also pretty balanced when she does this. Now, if you feel like you need to open up your feet a bit more, do so. As you get better at this kind of a squat, it's okay to bring your feet together. Now, I often get the question, you know, how close can my feet go and how deep can I go down into the squat? I mean, you can, as you get more comfortable and you can keep your body upright, and the key thing here is that you feel that you're using your butt muscles, not your quads, then you can theoretically go as deep as your body will allow you without losing your balance and using your using your glutes, not your quads, using your glutes consistently. So can we just have you do a few reps, maybe 5 reps or so up and down, and just kind of move slow, maybe take a second and come up and down so I can talk through here. So she's pushing her knees pretty wide and coming up, and if you can, go just a bit deeper each time. See, now her thighs are past parallel, and it looks really good. She's keeping her body upright. Great. But she's having to push her knees out wide and almost shove her hips a bit forward to do that. Would you do the next one just facing that way so I can show what that means? Perfect. So feet are out right here, feet are apart, and see how she's more upright here. She's not leaning over. A lot of hip bending and also knee bending, but her spine is more vertical, not tilted forward so much. Now here in the clinic, we've got, just do one more there and hold it at the bottom. Okay. We've got this thing to measure angles. Now if we go from the hip joint here, and this is parallel to the ground, you should, we'll go this way. You should be around 70 degrees or better. Go ahead and come on up.
Feeling the burn.
Yep, so she could stand to get a little better. I'm just gonna move closer here. This is the degree measurement, so we're just under 60 at 59. Now, I know Dr. Sam works out and she's not showing off her best squat here. She's just doing she's doing a good job, and she's feeling the right muscles. But let's see you get a little bit better. So let's get up to 70. I like to get people up to 70 ideally, and they'll feel their glute muscles work real nice. Good, you feel your glutes working there?
Yep.
Awesome, let's get the right angle on here. So I'm going from the hip joint to the shoulder joint. And yeah, that's approaching 70. All right, we're at 66 degrees now right there. So that's a lot better. If you can at least get above 45 degrees, so do a bad squat where you're tipping forward quite a bit. And let's do the same measurement. So let's go from vertical to the shoulder. Okay, come on up. So right there, she's at, what is that, 14 degrees from this horizontal, but we use this as a stationary arm. So her back should be ideally above 60, over closer to 70 degrees. So where she was at was in a good range. She's going to be using her glute muscles quite a bit, and that's what you need to do on the squat so that you avoid using the quads. Now, just a quick tidbit about why you should avoid your quads. I've got this in so many other videos, but if you're quad dominant on glutes, it's going to make you lean forward, which is going to increase the pressure of the patella, the kneecap, on the knee joint right here. It grinds the cartilage behind the kneecap against the end of the thigh bone and wears down your cartilage over time. This can cause osteoarthritis. It can also increase the pressure on the meniscus, which is the chunk of cartilage inside the knee joint right here. And over time, you can develop tears or wear it down quite a bit. There's a bunch of other problems that come on, muscle imbalances. It can cause hip pain, back pain, and even muscle imbalances. It can go down into the foot and cause ankle and heel pain. It can set off things like sciatica. So if you're chronically squatting incorrectly by leaning forward, it's bad. And it can be deceiving because sometimes even fitness trainers, physical therapists that aren't aware of doing this, they give you the false perception that you're doing well because they'll say, oh, good squat. They're not sure of the proper squat form, and they're saying you're feeling it, right? You're feeling a burn. And if it's on the front here, it can give you that feedback thinking that and make you think that it's the right kind of squat form, but it's not. You need to be feeling it in the butt muscle on the back every single time you squat. At least 8 out of 10 squats. If you can do this 80% of the time or better, then you're on track. So let's say you're gonna adjust your squat. Let's say your squat's terrible. Go ahead and go into a forward bend squat here. Just to sum up what you need to fix here, you're gonna turn your toes out, open your knees over your feet, allow your knees to pass your toes, and then shove your butt forward right there, trying to keep your heels down, and you should feel your butt muscles turning on. Go ahead and come on up. Now let's say you can't go that deep because you have knee problems, perfectly fine. Let's do a partial squat here. Same thing, go up even higher. Just do a little tiny, like a 90% up squat. There you go. You can squat like this with hardly any knee bend, but driving your knees out over your feet that are already pre-turned, and then shoving your hips forward here so that you turn on those butt muscles in the back. Holding a squat like this for 10 seconds and doing this over and over throughout the day strengthens your butt muscles really well. And you have to think about turning these off. If you can't turn off these quad muscles, then you might need to come up a bit higher and just literally just unlock your knees like that and focus and practice on using butt muscles without using the quads. What will happen if you're very quad dominant is there's a threshold. As soon as you start to go a bit too low, despite you keeping your knees out and shoving your hips forward, go ahead and do that light squat again, that little baby squat. And then if you go down like an inch more, there'll be that threshold where all of a sudden, no matter what you do, you're using your quads and you just can't help it. Go ahead and take a break. If that happens to you, that's your limit. You should not be looking to squat any deeper than that. Even if a healthcare professional is telling you this or a fitness professional is telling you this, you should not be squatting deeper than that, because then you're training your quads to take over every single time, which is going to mess up your knees as I just described. You need to make sure so that you don't fall backwards on your squats and you're doing a squat in a healthy way that's helpful for your knees, hips, back, and feet. You need to make sure that you don't go any deeper than your body will allow you without keeping the tension through the butt muscles as you're squatting. I hope this video was helpful for you. If you have more questions on how to do a squat properly, leave a comment below here, let us know. And don't forget to subscribe, turn on your notification bell so that you don't miss out on any of the helpful videos that we upload every single week. Have a wonderful day, guys. Bye-bye.
Bye.